Hello and welcome to the Ilene Silverman Show. I'm your host, Ilene, and on this week's program, our guests discuss the Alachua County Organization for Rural Needs, a nonprofit rural health clinic that has been helping our community for over 40 years and how you can be a part of their 2016 capital campaign. Stay with us. We'll be right back. Welcome back. Thanks for joining us for our program. Since ACORN Clinic was founded in 1974, it has grown from a small group of volunteers to a full-service medical and dental clinic dedicated to improving the health of our communities. To tell us more, I'm pleased to introduce my guest, Candice King, Executive Director of Alachua County Organization for Rural Needs. And Candice, it's wonderful to have you join us.
Always.
And of course, we know that as ACORN Clinic,
Yes.
Which has meant so much in our community, and you have been involved for many years. I congratulate you. Always involved, but once there and then left, came back since like 2013?
Yep.
Yes.
Sure
So
have.
you were there for the big 40th anniversary.
Yes.
And help us get a sense of the beginning of this
ACORN.
clinic. Yeah.
Sure. And I think to many people, I always like to say this, many people have heard of ACORN Clinic. They don't know exactly what it is, but they know that it's a good thing. And that's a wonderful
Yes,
reputation.
exactly. I've had the pleasure of being out there, of seeing it firsthand. But you're right, sometimes they go, ACORN, well, that's important to many communities now. It has definitely grown. So
Yeah.
what did the people who started it see? What was that need?
Well, the beginning was, and it was actually formed by two churches. Local churches collaborated. One is United Church of Gainesville, and the other is Westminster Presbyterian. They jointly funded a VISTA worker serving migrant workers out in the Manioka rural area of Alachua County. Since that time, we don't have migrant workers in that area now. They've moved south and west with the blueberries, but that was the initial function. And that VISTA worker, her name was Hap Taylor, said that she was spending a lot of time transporting workers in for health care services that they could not receive. So gradually the mission changed to a focus on health care. There were several different locations, again, out in the rural part of Alachua County, in La Crosse, and then a muddy field. And then where we're located right now is the very, very, very northern part of Alachua County, just before the Bradford County line, on a parcel of land that we purchased in the 80s. And since that time, we've grown from I call it trailerdom. We had medical clinic trailer, dental clinic trailer, to 2 houses moved out there that have been retrofitted 3 times now.
Amazing.
And then as a result of a capital campaign 16 years ago, we added a brand new dental building that has now seen a lot of wear and tear. We see a lot of people, and we're beginning a capital campaign to fix our structure, make it work, and expand our dental clinic.
It's time for that next
infusion
level, next infusion of the next step for ACORN Clinic.
Yes.
But it's all about making the lives of so many people healthier, thereby better. And who are the people? It has changed a bit, but who is that core group that you serve?
Interestingly enough, we serve patients from 24 counties in Florida.
I mean, that's amazing. That is a huge group.
Right.
Yeah.
Our primary counties we serve are Alachua, Bradford, and Union, and we target rural residents, and those that are low income and uninsured or underinsured. Now, anybody can come to ACORN Clinic.
Right.
No income requirements or in any way, but our primary target audience are those that have limited access to health care. for a number of reasons.
Right.
So we've been doing that for 43 years now. We're doing a pretty good job of it.
You must see the faces of so many people when you start to talk about it right now that
Yes.
just go through that file in your mind.
Yes.
Yes, because you've made such a huge difference in their lives. They
Oh,
must
we-
feel so gratified to know that somebody's interested in taking care of my health.
Right. And I guess that's another thing too, especially in our dental clinic. And Dr. Bhakta, our dental clinic director, will be talking to you about
Right.
this shortly, is that we provide excellent care, very patient-centered care, and people know it.
Right.
Our buildings are homey. I mean, in some ways they're
No,
a little
they are.
too homey, but to make people feel welcome.
Right.
We try to do everything we can to help them while they're on our site. So, for example, in our medical
Right.
clinic, we have a medicine room, and we have a lab on site. We have a social worker. We have available health management, counseling. We have
Wow. So you can address many
That's
needs.
correct.
And you collaborate with many partners within the
Absolutely.
community and refer people. So
we do.
yeah,
We do.
it doesn't just stop when you walk in and out of the door.
That's correct.
You keep it all
That's
going.
correct. That's
Right.
correct. We're part of the Healthcare Safety Net collaborative locally, in addition to other types of agencies like Peaceful Paths, for example,
Right.
and other places where we give them priority service, so to speak, because we're all
Exactly.
in this together.
Well, and then do you operate on a sliding scale?
We do.
First payment?
We do.
Okay.
So our budget is about half of our budget comes from patient fees that are sliding scale. We also are one of very few providers that take Medicaid.
Okay.
We also
Good
have
to know.
we also have Medicare. We'll take Medicare. So we take, and we also take Affordable Care Act insurance as well. Not many of our patients are eligible for that. They fall in that Medicaid gap.
Right.
But we have sliding scale, very, very cost conscious rates,
Right.
and we work with our patients in terms of payment plans. So
No one
we
is
do
turned
everything-
away.
That's correct.
Everyone receives the help they deserve, really.
Right. They have to make an appointment.
No, that's okay.
Well, and that's important to
good.
know.
Yes,
It's not
because
an
you have
urgent
to have
care.
right. And we have so much more we're going to talk about, and so much to look forward to for these many, many years of
Yes.
ACORN Clinic, and how we can all be a part of that. So stay with us. We'll be right back. We're back talking about ACORN Clinic, and I'm pleased to introduce Dr. Paayal Bhakta, Director of ACORN Dental Clinic. And it's wonderful to have you join us.
Thank you for having
And,
me.
oh, well, Paayal, I appreciate all that you are doing for ACORN and the way that you are organizing and taking care of all your patients at the dental clinic. I hear such positive things. I truly do.
Thank you.
And well, it's well done. And okay, we've talked about the beginning. So 1987, that starts the dental clinic, beginning of the dental clinic. Describe that first dental clinic. We already know we're in a trailer.
Yes, a two-chair trailer
Two
in
chairs, okay.
1987 that has expanded to 8 chairs now.
Wow.
It's a wonderful clinic. We're lucky to have volunteers, dental students from the University of Florida,
Okay.
hygiene students from Santa Fe.
That's how you make it all work.
Yeah,
Yes.
you do.
And really, you need to grow beyond 8 chairs, which is part of the
do.
capital campaign. You have
We're-
more people than you can probably take care of.
We're brimming at the lid with
Mhm.
8.
Mm-hmm.
Right now, there's a big need for the dental community to help those that are underserved or can't find the care that they need.
Right.
There are a lot of people that are within like a gap, so to speak, not Medicaid eligible, but the working poor that can't afford to go to a private practice dentist.
Right. And do you feel that among that part of our, population, that segment, dental care kind of gets just pushed aside?
Of course. A lot of the patients that we see are parents to children that are taking them first to the dentist or to the doctors. So they only come to us when it's an emergency, and at that point,
It's often
it is
too late for certain preventative care.
It is. And at one point, our wait list was 500 people trying to get in.
Oh my gosh, that's amazing.
It's
That's scary.
It is. It
Yeah.
is. 500 people, and these are people coming from as far as Cedar Key, people coming from Tallahassee. We had someone that right now is coming from north of Miami
to seek the care they need. Well, tell me more about what type of care do you offer?
We do comprehensive care, and if there's anything we couldn't do at the clinic, we find the channels to refer to. Comprehensive care is my main concern. I know that for the most part, patients are mostly interested in emergency care because that's what they think they need at that moment. But a lot of our patients come back for comprehensive exams when they see that an ounce of prevention can save you so much in the long run.
Right. So if you can get them there, even in more emergency, you can keep it from happening over and over again. But that's just, scary to think people have to wait that long.
It is.
Before they can get to you.
It is. And unfortunately, at that point, most patients are embarrassed and are afraid to go somewhere. Mm-hmm. But we always tell them, as soon as you step through that door, nobody judges how you got here at all. What I judge is if you don't come back, because I want to see you again.
Encouraging words, very encouraging. And you are multi-generational.
We are.
Yes. So tell me about the children that you take care of.
We do have a pediatric clinic on Tuesdays. We also do an outreach program.
Oh, she's right there. I love it.
She goes to local schools. She goes over oral hygiene, and she does it in a manner that the children understand. She also gives out oral hygiene products. So we try and educate as well as treat.
The importance of dental care as part of the education.
It is.
Yes.
A lack of education can also lead to poor dental health over time. So if you can get kids early enough, they can try and change the habits that their parents may have not known about.
Right. Only because they just didn't have the opportunity to know.
They didn't. And now someone comes in that makes it fun, that dresses up like a fairy. That
She's beautiful.
She is.
Yes. I can see how they would be enticed and get them to brush. She could get them to brush their teeth.
Yeah.
Yes.
Oh, yeah. There's a skit. It's wonderfully done.
Oh, I like that. I know it's very appreciated. And what about even in terms of dental care impacting your overall health?
Oh, it most certainly does. I like to think that everything is systemic in the body, but if you can't chew food, how are you digesting that food? How does that affect your GI tract? There's a lot that goes into it. How are you absorbing nutrients?
It doesn't just stand alone. Yes.
It doesn't. And again, if our patients come and they don't have medical care, we just tell them to walk right across to the medical clinic and get a primary care physician. It's nice to have everything right there because you can tell patients, if you need more than just me, I can help. We have people next door. We can be your team.
Right. Oh, I can see that. Good word. The ACORN Clinic team.
Mm-hmm.
I like that. You're doing a great job, and I really appreciate all the many things you have told us so that we're aware of the great dental clinic at ACORN.
Thank you.
And stay with us. We'll be right back. We're back talking about ACORN Clinic. And tell me more about the collaboration you have with students to make all of this possible. Paayal, how would you describe, because I know it's important to the dental clinic.
It is. The students are like the bloodline in the body. They keep us fresh. They keep us going. We're very fortunate that we have them.
And they love her.
Yeah, I can see where that would be so.
She's a wonderful mentor.
I have really good students.
Well, and so you were training them for their, future in the world of medicine, dentistry, all of that.
Which I'm hoping might include a public health component since they come up to ACORN.
We hope that by their experiencing working at ACORN Clinic, they see a side of dentistry that they might not have otherwise seen, and hopefully
take this forward.
Get a commitment to volunteerism for the rest of their life.
Yes, whether in this community or wherever they move, because it's important everywhere.
Yes.
So and there's also just the involvement. You're giving them the opportunity to be with the patients in a close relationship that I think would make for better medicine.
So we have in both the medical clinic and administration too, we have a whole slew of students also
that are there working away. Yes.
They do various things. We have a public relations intern, for example. We have a number of health administration interns. We've got a lot of volunteer student medical assistants and scribes and researchers, and so
yes, much more than we would think, looking through the doors.
They love it because not only is it interesting work, but it's real work.
Yes, and they know that making a difference.
Yes.
We always say that, but it really is true. when you're the one making the difference. It counts. And you must have so many stories of people that you have made a difference for. Can you share some, Paayal?
One that remains prominent in my head is we just recently had a young woman who is a veteran in the local community. She had gone to a dental clinic and was told that she needed to see an oral surgeon for a tooth abscess. She was
Hadn't she been in the ER a couple of
She
times?
had. She'd gone 2 or 3 times.
Oh, okay.
She came. We were able to get her in. She called on a Friday night, I believe. We were able to get her in on Monday, and we relieved her of the tooth. And she's doing much better.
Much lower than the $2,000
Yes,
that she was quoted
at the surgeon.
Where she said, "I just
She
will have to
couldn't-
suffer."
yeah,
she
she
couldn't do
couldn't-
it. I'd
she
have to
couldn't do it.
suffer. And I mean, how can it's so painful when something like that
Oh,
It
happens?
is.
awful.
Yes.
We had a patient recently that came in. She didn't realize she had an abscess, and it had flared up that morning when she came in. We referred her to the ER. We called over, and I actually got a call from the ER that if she hadn't gone in that night, she
Right.
would have died. And she was
Can you
very,
imagine?
Yeah.
when she came back, she was very
from her
verbal
tooth.
about it.
Can you imagine that kind of situation coming
To
up?
be
Somebody,
forced to that and have to go to the ER and
well, in
that
this
be the
case,
outcome. If
she
it
wouldn't
hadn't
have
have
gone to
been-
the ER. So
Right.
if it hadn't have been
yeah.
for ACORN,
Yeah,
if you weren't
absolutely.
here,
She
if
was
she'd not
emergency
known
walk-in.
about you,
Yeah,
the
so-
outcome can be very can
So-
be frightening.
So in the medical clinic, we hear all the time. Not that you don't hear that in dental.
No,
we hear
no,
all the
but I
time
could see
about
that.
saving lives.
You have a whole breast component.
We have
Tell me.
we've always had an emphasis on women's health, just because
Right.
that's the right thing to do.
It is.
Having said that, we have a breast health outreach program, and part of that is that we encourage women to come in for their annual exams. We have our clinics on Tuesdays and Thursdays extend until 8 o'clock at night, so
To
that
help people,
allow
working people
to
get
come.
there.
So just last month, we diagnosed a woman with stage 1 breast cancer, coming to us, and of course, getting care right away.
Right.
Make
Now
a
she
huge
has
difference
a
in her
chance.
life. That's right.
Right. And don't you feel that you mentioned about an emphasis on women's health, but women are often the one who will make sure their children
That's
get
right.
taken
And
care
their
of.
husband
They'll
and their
sit
family.
back. They'll say, "Oh no, I can get along."
Yeah.
And
That's
not
why.
really true,
That's why we
so-
have that emphasis. Is that we want to
Right.
make sure they're the rock of the family. They gotta
Exactly.
take care of themselves.
It really matters. And what about? I know you have a Spanish clinic.
We do. We do a couple of. Actually, we do a free homeless clinic in dental. So we work
Excellent.
in collaboration with Grace Marketplace and Helping Hands Clinic.
Yes, both
Two
wonderful.
churches who transport the patients to us. On the medical side, we have a free monthly Spanish clinic for migrant workers, and then we
So you're
also.
still
Yes.
true to that
That's
initial.
right. Well,
yeah,
you got to
purpose.
stay with your roots.
You do. You do. So that's still part of what you're doing.
Yes.
So when we're about to take a break, but with this capital campaign, you need people to step forward. You need the donations. You look at all you're doing, and
Yes, ma'am.
you could do more, and you want to do more, and you need to expand the facilities. It's
Yes.
very important. So we'll talk about that, and stay with us. We'll be right back. We're back discussing ACORN Clinic. And Candice, what is the goal of this capital campaign?
Well, we have a $500,000 goal. That goal will completely refurbish, replace, repair all of the current structure and allow us to expand our dental clinic. What we'd like to do is add 2 handicap accessible chairs
Excellent.
and expand the rooms that we need to do the backup work, so to speak, the prep work
Right.
for our clinic.
Okay. I see the need. Paayal has already expressed
That's
the need
right.
and how many people are waiting and need the care. And where are you now as you've begun the campaign? Can you give us an update?
We began in 2016. We're about $150,000 into it. The very good news is that soon we will be awarded a federal grant that will match up to 35% of local contributions. So that'll expand
Right.
our,
So everyone giving a donation, that's going to be
expanded
doubled
through.
and expanded. So
Right.
very important we all
Yes.
get started right away because you have the statistics to back up the need of ACORN Clinic.
So
Share some of
let
those.
me
Tell
roll
me,
some
please.
patient statistics for you. So at any one time, we have 3,000 patients of record between the 2 clinics. And in a typical year, we have 10,000 patient visits. So, that's
a lot of people going through those doors. Yes,
the doors.
It
So
is.
since the last capital campaign, which was 16 years ago, we've had 160,000 bodies walking through city, touching walls.
Right. No, that takes a lot of wear and tear.
Well, yeah, some of our dental chairs are 20 years old.
Okay.
I mean,
We just replaced one that was 25.
Yeah, we just had to replace one.
Okay,
25.
that's longevity, but after a while, we don't want the
we
patient
take
to
care
fall
of our
over
things,
the back.
That's exactly right. And sometimes you can only
Safety.
strip a few nuts a few more times.
I
So
know.
that's
I
where
can
we
see.
are. So the
So
other
that's
thing we
important.
do really well is that we leverage, and we've already talked about our service learning function, how we
Right.
use volunteers. Community volunteers really
Extremely
help us a lot.
important to you.
So last year, for example, the value of our volunteer service was over $1.13 million.
When I read that
Can you believe that? I
in
mean, that's
presentation,
yes,
amazing. But that shows how many people
care.
care.
Yes, we
They're
allow
caring
them
about
to show.
Yes.
We allow
and
them to show their care.
this is how they can express it. So what are some of the things somebody could get hold of you to be able to volunteer and join this team?
Well, we have all kinds of opportunities. We really look for people to be longtime supporters. We call them Friends of ACORN.
Okay,
And
got it. Yes.
you can donate your time, talent, and treasure. So we're always looking for especially volunteer dentists.
Okay, good. That's how you make it happen, right?
Yes.
And speaking of volunteers and special people, tell me about this award that we've
Yeah,
had here.
so we've got a couple of things on display. This lovely glass award was it's a Sapphire Award from the Florida Blue Foundation. It's one of probably about 15 different national and local awards that ACORN's received for our model. So what we do, we really are a gem in this community. And
You are.
and when I say we, it's a team
No,
effort.
I know. It's
all of
everybody.
us.
It's the ACORN
It's
team.
43 years worth of fabulous volunteers, fabulous staff, wonderful leadership by our board of directors. So another very cool thing here is
Yes,
this,
I
this
like that
image. So Diana Tonneson is the artist. This is woodcut, woodblock printing. She's made this image for our capital campaign, and in fact, we're making posters on gelée paper that we will give to our donors that donate over $100. So we're very excited. She's just finished the image. We're in production mode.
Oh,
on
I think
now.
it is perfect.
I think
And
it's lovely.
it brings it all together because you know, every donation is going to count.
Yes.
Absolutely.
As you're saying, people,
Absolutely.
our viewers need to know their time, their talent, their financial support, in all ways makes a difference. Because this is truly a community effort, a
It
community
is.
medical and dental clinic serving the community. And I just want to congratulate you, Paayal, on the dental clinic, the wonderful things you are achieving. And Candice, my longtime friend, I'm so proud of your leadership as executive director.
It's thrilling to
and
be able to do this kind of job.
I can see it. It
Absolutely.
comes through from both of you and to all the community volunteers. And for those of us, it's our time to step up and give, be part of this capital campaign. Thank you both so very much.
Absolutely.
My pleasure. And I'm so glad you tuned in, and I hope you'll join us next week. Take care.